The president has announced that he's contracted COVID. The first thing I want to ask you is, the president has, first of all, really kind of been in denial about COVID and really downplayed it over the months. And recently he has held campaign events. He's been around a lot of people. So can we talk first about just the risk of other people within his campaign, people who have attended his campaign, and their possible risk for exposure?
Right. Well, thank you. So, I think from day one of this pandemic, the president has disregarded the science, data, and facts. This has created an unprecedented public health catastrophe that we know was preventable. And now it is caught up with the president, and it is caught up with his administration. This virus isn't political, and wearing masks shouldn't be political. Look at what other countries have managed to do across the world. And this president has the best access to medical care, in the country, probably in the world. And unfortunately, the same cannot be said for the nearly 250,000 Americans who have died from this virus, including the 847 who died just yesterday. So, and outrageously, I'm being told now that even with the situation with people testing positive, that White House staff are not wearing masks. And it's entirely plausible that members of the public have been put at risk due to the denial on the part of the most powerful man in the world.
And you talk about other people, potentially being put at risk. The president has been exposed to so many people that we've seen at campaign rallies and so forth, traveling. In cases like this, where do you even begin in terms of contact tracing? It seems like such a huge process.
Right. Well, I think the other thing this has shown is you can't be put in a bubble with regard to this virus. And I think what is also being lost here is we know how to prevent and slow the transmission of this virus. It's wearing the mask, it's social distancing, it's good hygiene. I mean, it is not a complex situation in terms of how we can slow the spread of the virus. If we don't take those precautions, we have seen repeatedly that the virus is spread and public health is put at risk. Unfortunately, if people have had prolonged contact with others in closed spaces, particularly indoors, the virus is rapidly transmitted. And particularly people with comorbid conditions, other health conditions, people over the age of 60 are extremely at high risk. But we also know other people can get very sick and even die from the virus who are not elderly or have comorbid conditions. So this is just, this was inevitable. And again, what I would say is, the negligence and the disregard for the prevention measures that we've seen this president espouse since the beginning of the pandemic, it has now caught up with him and the administration.
A lot of people now are wondering what's next. How serious could this be? We know that coronavirus affects people differently, but we do know that there may be some risk factors involved here, specifically maybe with age.
Right. Well, I think that in terms of what's next is, I think for the country, we need to have a national strategy, right? We need to have a national strategy that focuses on the science, data, and facts. We need to ensure that our government institutions that have shown leadership in the past with regard to infectious disease control are given the ability to do that people can speak freely, that the data and science is put out there. And we need a national strategy in order to get this pandemic under better control. The mask wearing, the social distancing, the hygiene, and really ensuring that there is support for that at all levels of the government. Winter is coming. It is going to get cold in many parts of the country. Flu season is coming. Where is the national leadership on this issue?
And we did recently learn that Vice President Biden has tested negative. So I think that's another proof that mask wearing is effective, social distancing is effective, which he's displayed for quite a while.
Well, I think one thing that we need to emphasize is, a negative test only tells you at that moment whether a virus has been detected, right? So there's the incubation period, there's the quarantine, the isolation period. So what I think will be really important, and also to watch, and I certainly hope that people who've been exposed follow quarantine guidelines. People who test positive follow isolation guidelines. I mean, these are things that we've really supported people doing in San Francisco, and I certainly hope that those will be guidelines that are adhered to in the office, at the highest office in the land.